Hello, I am Urologist Ömür Erdem Akkaya. Today I will have a short video presentation about the undescended testis. While the testicles are in the womb, they begin to form just below the kidneys. They go down in time and pass through the inguinal canal just before the pregnancy ends and settle in the bag. If the baby is in the 6th month and the bag is still empty and the testicles are up, we call it undescended testicle. How do we diagnose it? With physical examination and ultrasound, we can provide information about the location of the testicles. If we cannot find the testicle by ultrasound and physical examination, then the testicles may be in the abdomen. Then, with the camera we call laparoscopy, we can get information about the size and location of the testicles by seeing inside the abdomen. What are the risks of an undescended testicle? In the undescended testicle, the volume of the testicles may decrease and the ability to produce sperm may decrease. The baby has a 25% risk of infertility in unilateral undescended testis and 75% in bilateral undescended testis when he reaches adulthood. If the child has reached the age of 1, we definitely recommend surgical operation in undescended testis. So, is there no medication treatment? Unfortunately, 80% of previous treatments with the medication resulted in failure in undescended testicles. That is why medication therapy is no longer used today. There is also a condition that we call retractile testis. This is not a disease. The testicles are sometimes observed in the scrotum, especially in hot environments, while the child is sleeping. However, during physical examination in a cold environment, the testicle may pull itself upwards with the effect of the cremaster muscles. This is not just any disease or a pathological condition. There is no need for any treatment. It is necessary to distinguish between these two. How is the operation performed in undescended testis? When the child reaches the age of 1, the operation is recommended. In the operation, the testis is freed from the surrounding tissue with an incision of approximately 3 cm from the inguinal area. If there is, the hernia is cured and the testis is delivered to the scrotum area. It is an operation of about 45 minutes. 3 hours after the operation, the child can eat. We have a chance to discharge the child the next day or the same day. Apart from that, when can we understand whether there is infertility in children who have undescended testicle operation? We can only understand this when the child reaches adulthood, sperm production age. Unfortunately, it is not possible to understand this in the early period. An annual or 6-month testicular check is sufficient during follow-up. Older children also come and it is better to have an operation as soon as possible. Because if the testicle is in the abdomen or if there is an undescended testicle condition, the probability of cancer development from the testicle is higher than the normal population. Therefore, the testicle is either removed or lowered in the undescended testicle condition. Thank you for listening, best regards.